My name is Stephanie Arnold. I'm a consultant dermatologist at the Churchill Hospital in Oxford, England. Well, there's a bit of a funny story with why I chose to specialise in dermatology. Originally, when I left medical school, I wanted to be a pathologist, but having worked for a few months in that specialisation, I found that I really missed speaking to patients and found myself talking to the specimens, which wasn't that great. So I had to look again, and I wanted a specialty where I could see all sorts of different people. I wanted a specialty that had variety, not only in terms of the types of people I might meet, but also the types of conditions I might see. And I also wanted something that I thought might be able to fit with family life and having a family and not being called in at 3 o'clock in the morning. I grew up in Sydney, Australia, not too far from the beach and from the beautiful harbour. I loved growing up in Sydney. It was a great place to be a kid, and I miss it a lot, having moved here to the UK. I moved to England, to Oxford, in 2011, so more than 10 years ago now, and this is my new home. I love Oxford. I love the beautiful countryside that's in the surrounding area. The history blows my mind every time I go through the town, but yeah, Sydney will always have a very special place in my heart. The things that I find most rewarding about my job are the variety of the conditions that I see, but also the real variety of patients that I see. So I look after skin from newborn babies up to very elderly people all through life. Almost all of us will have at least one problem with our skin at some point in our life, and I get to help patients through that. So I find that very rewarding. No day is the same as any other in dermatology. Some days I'll be operating and doing procedures or laser work. Other days I'll be in clinic seeing patients and providing advice about medications, creams, and other treatments. And some weeks I do skin cancer work. Other weeks I have my vulval clinic. So it really is very interesting to me. I'm always seeing something new, and yeah, never a dull moment here. So I guess it's sometimes hard to know what patients value most about me, but I think the thing that I hear most from patients is that they're grateful that I spend the time with them to explain what's going on, what their diagnosis is, and how we can get things better for them. And I do think it's absolutely vital for patients to understand what the problem is, but also how they can help fix it. And if I just hand a patient a cream and tell them to go and put it on, then that hasn't been a successful clinical consultation, because I think patients really need to feel involved in their treatment and in the decision-making process, but also they need to really understand how much cream to apply, where to apply it, how often, and also how long. You know, how is this going to be something they do for months, or is this something that they do just for a week or two? And so I think in my practice, I really try and spend the time that the patient needs to fully understand what they need to do, so that then they can feel confident in looking after their skin. What do I value from my patients? Oh, lots of things, really. I love the fact that I can help people, and I love the fact that I can have a bit of a laugh and a bit of fun with my patients. I think I try to always work as part of a team for patients, where I work with them, not sort of instructing a patient with what to do, but rather together we come to a plan about what's going to work best for you as the patient. And that's actually quite fun, and I'm always amazed at the interesting ideas that patients have themselves, and that then I've been able to take on board and perhaps offer as advice to other patients, and I find that really, really rewarding.